I'm going to demonstrate IV insertion with your IV medication administration. You are first going to come into the room and introduce yourself to your client and get your supplies ready. All my supplies are here and ready. I have my T connector, hand hygiene, my MAR, my flush, I have my IV start kit. Everything is ready and in my start kit. I have stocked it and everything is in there. I have my secondary tubing set along with my medication. I have checked that my medication is correct and it is the correct patient. I'm doing Unison 1.5 grams and 100 milliliters, and it's IV piggyback. And I have my sharp that I'm going to use. Okay. All right. Miss Fuchsia, hello. My name's Amanda. I'm going to be taking care of you today. We're going to start an IV on you. The doctor has ordered some medications. They want some fluids to go. They want you to get some lactated ringers. So I'm just going to clarify and make sure you are who you are. All right. Miss Fuchsia, date of birth. All right, 8/1/60. Do you have any allergies to medicines, Cody? Okay. All right. That has no contraindications or no allergic reactions to Unison, correct? No. Okay. All right. And I've looked it up in my med book, and there's no side effects or anything, or no issues with her getting that medication. All right. Now I'm just going to look on your arm and just find an IV that or a vein and check and see. And is there any issue with me sticking your right arm? You've not had any shunts, no mastectomies, or no, nothing over here that there would be a problem with me doing sticks, right? No. Okay, great. All right, okie dokie. Going to raise my bed since I have everything over here. Make it a little more comfortable. All right, raise my table. One more time. I'll open my start kit and get out my tourniquet. Get out my Tegaderm, I'll need that. My 2x2s. And my alpha left prep swab. And those are extra 2x2s. Okay. I'm going to go ahead here. So just have it ready. Okay. All right, Miss Fuchsia. Just going to put a little tight band on you here, okay? So how are you doing today? Good. Good. I'm sorry, I did not mean to. Well, the medication, it's an antibiotic. Yep. Now you're going to be getting it 3 times a day. All right, just looking here for a vein. All right, I'm going to fill one right through here. I'm using the alcohol swab. I'm going to prep my site just to clean. Okay. All right, just clean my site. Okay, and then I'm going to pop my tourniquet while that dries. Okay, and then I'll do hand hygiene one more time. Not to be too many times. All right, and then I'm going to prepare and put my supplies together while that dries. Okay, Tegaderm. I'll need a T connector. And then I'm going to flush. and to not contaminate my tip. And to keep that, there you go. I'm gonna set that right back in there. Okay, a little bit of gloves now that I'm gonna, so I don't, in case I come into contact with any body fluid. Okay. Alright. So Ms. Fusion, are you okay with needles? They don't scare you any? Or not that they scare you, they don't bother you any? Alright, good. Alright. Okay. If I have a second alcohol swab, I'm going to use that. So just touch one, make sure I didn't lose sight of that. Alright, scrub one more time. That's going to dry. Okay. Alright. I'm going to open my needle. This is just the outside cap, so those can go there. Alright. I'm going to look and find my bevel up. And that will be inserted. Alright. I'm going to look for the light and then insert at a 10 to 15 degree angle. I'll feel a little poke, right? And continue to insert till I see a flash. There'll be a flash that'll come into my hub here. Once I get a flash, I'm going to insert just a little bit more, and then I'm going to advance my catheter a little bit on it. Okay. And pull this on out. I'm going to put pressure above my hub. Be careful not to touch where my catheter goes into the skin. Be careful to not contaminate. And this goes straight into the Sharps box. Okay, and then I'm going to pop my tourniquet immediately. And then I am going to unscrew the lid off of my T-connector. Still not touching the end. Keeping it clean, sterile. And go straight into my hub. And on to my patient. Okay. Being careful to still not touch anywhere from here to here or here to here. And flush. Beautiful. Alright. So, I'm going to take my Tegaderm and place over the site. And it's important that I just cover at the insertion site of the skin. So that's what I really want to cover. So I'm going to cover that. Alright, Ms. Fuchsia, and that is in. It looks good. Okay, I'm just going to secure it down now, okay? Alright. Alright, and I'm just leaving that connected for the moment because I'm just... And then just get a piece of tape. Alright. Secure here. There's multiple ways of securing, but what you really want to make sure is that you are not kinking your tubing and you can still see your site. Okay. Alright. Now, you can clamp as needed, but because we have ordered our fluids and we are going to get ready to do our secondary set, then we want to go ahead and just connect here before when I disconnect this. Alright. Now we have our cap on. I'm just going to disconnect my cap from here, still clean, and go straight from my syringe here and my cap and go straight on. Okay. And then get away from my patient so it's not bothering. And then my pump is set for 125 an hour and infusing. Now, since I've started my IV, what I'm going to do is date, time, and initial my site here so people know when this IV was inserted. And then I can also document it on my narrative where it was inserted on the right forearm. So 22 gauge, 1 times 1 attempt, patient tolerated well. Alright, and then we're going to go ahead and set up our secondary set. Clean up my mess. Miss Fusion, you okay? Good, good, good. Didn't hurt too bad, did it? No? Awesome. I always like that. I know. Okay. So one more time, our secondary check, just making sure it's all done. So we are doing unison 1.5 and 100 milliliters to be given to Miss Fusion. All right. And then just double checking our armband, same thing. Even though I didn't go out of the room, I'm still double checking. I know, I'm one of those nurses, I'm sorry. Okay, just making sure that we have all of our stuff here. Can never have too many alcohol swabs. You can have multiple ones. All right, so we have our tubings and our labels in our bag on top of our secondary set and our hanger. All right, now if we should have to add any medications, that's what that is for, and this is for the day that we should hang it. Okay. All right. When you have your patient on their fluids, you would take their primary, and we are going to put this here. We're going to hang it. Okay. All right. And just want to clean one more time. Really should give me some green ones. I like green ones. Thanks for girls, I know. Red ones would be awesome too. Is your IV feeling okay? Not having any redness or anything. So since that's infusing, so you can always check and make sure that there's no signs of like any phlebitis or anything. Go here, just get ready to prime your tubing. You want to pop off, being sure to keep it clean. And that's a really good pop. There you go. And then try not to let that touch anything, so just keep those fingers there. And then same thing here, just come straight off. Don't let that touch anything. You want to keep them sterile. Best way, try not to get any air into this. Just keep, and then go straight in, twist in. That kind of helps it get in a little quick better. And then you can just pump it a couple of times to let the fluid come into the chamber. Usually a quarter of the way or third of the way is good. You can go ahead and hang there on the right next to where you've hung your primary tubing. And then you're going to prime. This way you can see a little better. So you're going to slowly open your clamp. If you let the clamp all the way open, it's just going to flood out. So just slowly open your clamp, and your tubing should come out until you get all your air bubbles out. Okay. And then clamp it back. You don't want to lose too much there because we don't want to lose all your medicine, right, Miss Fusion? Right. I know. Okay. Alright, so we have an alcohol swab, and what we're going to do is, because this is a secondary set, we're going to go to the set, or to the port that is closest to your bag, and we're going to scrub that, let that dry, still clamp, alright, and then we're going to pop off that cap, and go straight on, and screw it on. Okay. Now, if you're going to be running it over milliliters per hour, we're just going to plug it into the, program it into the pump, okay? If you are going to be running it by drops per minute, what you are going to do is you are going to put this all the way open, and then you're going to adjust your drops per minute accordingly to your primary set. Alright, and then once that runs for the time that it's going to run, usually Unison runs in over an hour. I'm going to confirm that with my medication book. Then I'll come back and check on her, make sure that I flip it back to my primary set. I'm going to get that running back at 125 an hour as it was ordered. Alright, and right before I should walk out of the room, I'll go ahead and put my tubing on. That way they know the day that I use this in case they should have to reuse it. Alright, so she is getting it 3 times a day. Oops, we'll get a new tubing. Okay, alright. Miss Fusion, is there anything I can do for you? No? Alright. Is everything okay? Good. Alright. So I'm cleaning up my mess here. I'm just going to come out, clean it one more time. I'm going to document on the MAR when I give the Unison and the fluids. Just, you've got the time here, it's 0800. Just date and my initials. Okay. And then we are going to lower the bed back down because I raised you up. I don't want you to accidentally fall and get out of the bed, especially got these fluids hooked in. And then you got your call light handy. Sweet. Alright. Got your TV remote good? Alright, there you go. Alright. Okay, that is it. Hook it up.